A very good evening, Dr. Jitesh. How are you?
Good evening. I'm good. How are you?
All good. Could you please give us your brief intro?
Myself, Dr. Jitesh Sharma, and I reside from Odisha, and I'm a MD
Oh.
homeopath. Uh, there we have a subject, Matria Medica. I'm MD in that subject, and
Okay.
yeah, and I have a hospital, homeopathic hospital, proper homeopathic hospital in Odisha.
Okay. So, sir, from which colleges and which year you have graduated your graduation and post graduation?
I did my undergrad from Jamshedpur, from a homeopathic
Okay.
college from Jamshedpur, and my PG I did from Patna. And in the year
Okay.
2011, I was graduated, and I did PG like 2016. Yes.
Okay, right. So, sir, let's start from the very beginning. The major objective of this conversation was जो भी लोग confused होते हैं regarding if they have to choose MBBS, BDS, BHMS or any other field, so they will get a guide. So, what subjects to choose from if one has to enter into BHMS? Like 11th, 12th में क्या subjects होने चाहिए?
Basics, biophysics, chemistry is enough. Like we
Right,
generally say yes, PCM,
PCB.
PCB, yes, or
Right.
PCMB
अगर
also
maths.
is fine, but bio
Okay,
is
okay.
compulsory.
Right, got it. So, sir, after 12th exams, now जो students है, they have graduated and they have done their 12th. Now, what exams to give the basic cutoffs?
They can give basic NEET, and generally it's a 45. Like it depends. It varies from year to year. Basically, 45 percentile is the cutoff goes for BHMS. So
Okay,
in the general category, I'm talking about
right,
last year. So it depends. And through NEET they can get into a private or a government college. With good score, definitely they can get a government college. And all over India, I
right.
believe there are 293 colleges, or
Okay,
government and private mix.
okay,
Yes.
right. And sir, like how to choose? जैसे हमारे dentistry में we say that if you have to choose a good dental college, see for the number of patients or the faculty or the students. So how to know that this college is a good one for BHMS?
See, there are many colleges who has great OPD and IPD services. So you need to select there which college has good amount of footfall of patients really, because once you choose BHMS especially, you need more of clinical training, right?
Right,
So clinical training ke liye you must have a good exposure to patients, and that will be done in your undergrad time. And you have to go
right.
for like from third year or second year, you go for a clinical OPD or IPD.
Okay,
You should see patients live in front of your eyes. So many colleges has that facility. So you need to choose accordingly, which has a more footfall, more less. So it accordingly depends, and depend their own choices where they want to do.
right,
And
right.
these days, like every government OPD has more than like per day around 1500, 2000 OPD, and sometimes
Wow.
other colleges also have 3000. Yeah, it's huge actually. You need to decide which college you get. It's a totally depend upon your rank then.
Okay, got it. So, sir, any fee structure idea that you have regarding the private colleges or the government right now?
Uh, I really don't remember, but it depends. Like government colleges also like I think very less. Government colleges are very less. Private, I can say it's like 1 lakh, 1.5 per year.
Per year, yeah.
Yeah, per year.
And this must be exclusion of the hostel.
Yes, exclusion of the hostel.
Right. Okay. And sir, like I know the basic criteria. If a dental student wants to get into dentistry, तो उसको क्या क्या choose करना चाहिए? So how do I know कि मतलब मेरे लिए BHMS है या नहीं?
See, it all depends on what the student wants to do in future. Like he wants to pursue as a dentist as a career or as a physician. So,
Right.
see, dentist is entirely on oral cavity and everything. But when you choose a BHMS, it basically is equal to holistic approach. So
Right.
So now he has to treat from every disease from head to foot as a
Right.
doctor, and it's
Right.
equivalent to MBBS because we study all subjects what MBBS people generally study. The
Agreed.
only part of the difference is pharmacopoeia is a bit different, totally entirely different.
Okay.
What make us different from BHMS and MBBS? And
Okay.
and the best part is if anybody chooses BHMS, they can have wider scope. And let me tell you, we have we have a British Dental Homeopathic Association, just off the
Okay.
record, and
Okay.
there are many dentists, because in India only you can directly graduate and do a 5.5 years course and call yourself homeopathic doctor.
Right.
But
Right.
in abroad, generally you have to pass from a medical school. Then, as a specialization or super specialization, you can choose homeopathy as integrated science in your practice, and that's
Okay.
legal.
Got it. Okay. Got
So
it. So,
that's why,
yeah.
yes, that's why India has a great scope. Basically, you can study 5.5 years, you can do MD for 3 years, and you can practice. And regarding the BDS, I have seen amazing dentist who has been recommending homeopathic medicines because it
Right.
has a great scope. There is a book also of Dr. B. Colin Lessell. He was a
Okay.
he was actually great dentist, and
Okay.
he applied homeopathic in his science. So many diseases, like even in pericoronitis
Right.
or ailments from wisdom tooth and jaw pain, even in trismus, even in renula, even in oral lichen planus, even in you can find trigeminal neuralgias. So there are a lot of scope. Even in pemphigus, oral pemphigus, we have such a great medicine. So I would not say every science has their own capabilities regarding BDS, BHMS, and
Yeah.
MBBS. It's all about your choice that what do you want to pursue.
Right. That book is on my list, sir. And the next question important is the journey. जब आप first year में होंगे, since the day you get admission and since the day you get your degree or the convocation, the whole journey, what subjects you get, क्या क्या exams होते हैं. Can you just share us
Yes.
briefly?
Early, like first year, like when I studied, the syllabus is quite changed now. When
Okay.
I studied like 4 to 5 subjects in the first year, five
Okay.
subjects. Now it's only three on
Okay.
the
Which are?
first year. And anat physio with biochemistry and this uh, pharmacy.
Okay. Okay.
And
We had the same.
yes, and in the second year, it's FMT pathology, materia medica. That's what introduced in first year. That's the medicine part, and you get
Okay.
this organon of medicine. That's how
Okay.
basically Bible. You can say the cardinal principle book, and we have to follow everything by book from that organon of medicine. It's a book written by a master Hahnemann, and he has given the way
Okay.
and method to dispense the medicine and everything, and how to treat the
Okay.
diseases as well. It's a basically manual which has to be followed word by word. And
Right. Got it.
in third year, gynae ops and pedia practice of medicine. Then again, MM is continued and practice of medicine. And in fifth year, you get fourth year. Sorry, you get materia medica is a continued subject with alights
Okay.
till final year,
Got it.
and you get new subjects
Okay.
like repertory in final year, along with other subjects, and PM practice of medicine, and
Okay.
also community medicine is the final year.
Okay. And the final year, which is the fifth year, is the internship year?
No, after completion of fourth year, you can get you have to do internship for 1 year.
Yeah. So that total 5 years.
5 years, 5 years, 5.5 basically,
Okay.
because
Right.
first year is
Right.
1.5.
Yeah.
First
Yeah.
year is 1.5.
Yeah. Right. Okay. So in all the years, there are theory and practicals happening.
Yes.
Okay, got it. So, sir, like each subject has its, like each field has its advantages and disadvantages. So, what field you are in, BHMS की क्या challenges हैं?
See, challenges is we also have scope and limitations. It depends. It depends upon cases to cases. If somebody has an, a large hernia, like few surgical cases or we have to recommend to a surgeon, and that
Yeah,
we cannot do, right? So
right,
major surgical cases are generally referred to a surgeon. And
right.
yes, regarding the management, we can be part of as an integrated medicine, and which has been doing since many years.
Right.
So mostly engross, which is only possible by surgical treatment. That is always referred. We do have a limitation on that, but not on basically not on all surgical cases, like on kidney stones or gallbladder calculi, and most of peritonitis, or this one can be managed by medicine also. And in older times, like our science is 200 and like more than 220 years old. So
Okay.
in olden times, all the majority of the hospitals in Europe, in UK, they had an integrated facility along with homeopathy, and which India also is doing now. Like all the AIMS in India,
Right.
all AIMS have an OPD of homeopathy now.
Oh wow.
Actually, it has a great scope, and I believe integrated medicine is the future. And homeopathy is also has their own way of treatment, where you other pathies do not help. So basically, if a child or if a student really wants that to help the humanity, he can definitely opt for homeopathy. But just a word of caution: it requires a lot of effort. It's
Okay.
not easy, because we have like more than 5,000 of medicine, you know,
Right.
and and you have to be well versed with at least 200-300 medicines for a good practice in your clinic.
Okay.
And for that, you require a lot of efforts. There were night reading, sleepless nights, and you have to first in our part. See, case taking is everywhere is the same, but in our a bit different. Like you need to understand the patient in approach. Like if suppose he comes with a cold and coryza, and he says that I have caught cold and I'm sneezing a lot, and my nasal is having acrid discharge from 3 days, and I'm not feeling well, sir. I feel I'll get a fever also. So as soon as he comes, we need to ask that what you have taken or where you went somewhere. And he'll recall, yes, I had taken 2 ice creams yesterday, and even I got wet in rain, and then I got good. So that is the cause. Accordingly, that we have to give a medicine. So we have certain set of medicines which has this exposure to cold things or wet. So then only the medicine gonna work, or it's fail. It will fail, and they
Okay.
will say,
Okay.
that homeopathy is not working. So this is totally an art. Do you need to
Right.
understand what is the cause?
Right.
If someone develops an angina, and last night only his son is died, so that is
Yeah.
angina from grief. So we have a certain
Right.
set of remedies for grief. So as soon as we give that medicine, his angina pain can reduce immediately. So it has. So we need to understand that in a holistic way what actually has went wrong with that person. Then only we can be focused. See, we should have a knowledge of disease, but very well, knowledge of disease is very important. But we need to treat the patient first, not the disease. That's a rule. We need
Right.
to understand
Right.
the patient, what has actually went wrong.
It's a little opposite of dentistry, because in dentistry ours is जब तक हम दांत को नहीं टच करेंगे that there is no treatment, because in us there is very less medicines. So sir, for you, आप MBBS में जाना चाहते थे, फिर BHMS में गए, या फिर your first choice
No,
was
no,
BHMS?
my always choice was BHMS, because my father is a
Oh,
homeopath. So since childhood
okay,
I've been seeing it, so I know BHMS will be the always first choice. So I was never
okay.
it's my choice to do BHMS, because I really want to be a homeopath first.
Right. राइट सो सर बीएचएमएस का जस्ट आई वांट टू अंडरस्टैंड कि एक मेडिसिन अगर आपने दी तो एटलीस्ट उसको कितना टाइम लगता है टू वर्क
See,
ऑल्दो इट
our hospital
डिपेंड्स
has
ऑन द
a
कॉज एंड द सिवियरिटी
yes.
बट
If you
या
in acute, if you give a
या
right medicine, it should work within like 10 to 20 minutes maximum.
ओह ओके एंड
It's
इफ
more
इट्स
fast.
क्रॉनिक
Chronic also you can feel the effect like right away in 20 to 25 minutes, but you need to
ओके
continue for a bit. It's not like you have to you take today and you will feel better like day after tomorrow. It's not like that. On the same
राइट
day, on the very day, on the 20 minutes, you will feel the effect of the medicine right away in your body. It's not like it will take ages to make you feel that you are better or not. See, clinically you may be
ओके
better, but the pathological or structurally it takes time. That's the way.
right exactly so sir can a BHMS from India just a like the graduation from India can practice in abroad
Uh, No, he has to practice like he has to be a like MBBS also or a pass out from med school. But depends again. Different countries have different rules. But a
Different
BHMS can
rules.
practice. Yeah, but BHMS can practice in Dubai because they have an
Okay.
examination MOH set. There is an exam, and if they pass in the they can practice anywhere in UAE if they can tie up with any hospital, and they can practice homeopathy only, pure homeopathy. They can do that.
Okay.
So
Okay.
UAE is
And
giving a great opportunity here for all the homeopaths.
okay.
Yes.
Okay. And like BHMS करके तो हम BHMS कर ही सकते हैं. Like we can continue that practice. उसके अलावा what a BHMS can do in India or abroad.
It depends. Like many BHMS students who want to pursue higher education, they have done MBA in healthcare because it treated as undergrad only. So you're a graduate, right? So after getting
Right.
BHMS degree, you can do any master course on any medical field or MSc or whatever you want to do. Or even you want to go
Okay.
in research, you can do MSc. Many students have done it, and they can go into health sector. They
Okay.
can go into a good companies or MNCs also. So it depends. If you do some higher courses after BHMS, you can get employed anywhere you want to. It's has great scope. There's no issues at all. But on the medical sector
Okay.
only. That's a clause on the medical sector.
And does a BHMS, I'm quite sure this question might be coming. So, does a BHMS doctor use a stethoscope?
Of course, this is really irrelevant. Of course,
Okay.
okay.
Because
We are a
we, as a
physician.
dentist, right, exactly. Because we do get a lot of questions, but we do use it, but हमारा काम थोड़ा कम ही होता है. We use it for the
Of course,
physiology and yeah.
we have to do all systemic examination from CNS, respiratory. How would you do without stethoscope? Come on. So
Right. सर वी एज डेंटिस्ट हैव कुछ मिथ्स हैं हमारी फील्ड्स में लाइक जैसे हम दांत निकालेंगे ऊपर का तो आंखें खराब हो जाएंगी दांत हिलने लग जाएंगे अननेसेसरी मिथ्स सो ऐसी कुछ मिथ्स आपके इंडस्ट्री में भी हैं.
नहीं, ऐसा कोई मिथ नहीं है. हाँ, बहुत से राइट मेडिसिन देते हैं. वी सिलेक्ट अ राइट मेडिसिन राइट अवे इट एक्ट्स. तो किसी किसी को लगता है अरे इसमें जरूर कुछ मिलाया होगा कि होम्योपैथी इतना जल्दी कैसे काम करता है. एंड
ओके ओके
तो ऐसा ऐसा लगता है लोगों को. बट द फैक्ट इज इफ यू गेट अ राइट मेडिसिन राइट अवे द रिजल्ट विल बी वेरी वेरी क्विक. वेरी
राइट
क्विक.
एंड वो राइट मेडिसिन राइट इंटेंसिटी राइट टाइम पे देना इट्स द आर्ट ऑफ द डॉक्टर.
Yes, it is totally upon the skill of a homeopathic physician that how he
राइट
understands the case and how he gives the medicine. That totally depends upon him.
राइट एंड सर लाइक हमने BHMS किया एंड वी जॉइन a clinic or we join something so what is the basic salary range that you get? I'm not talking about the government job but uske alawa.
It depends. Like nowadays, there are many openings. You can many get 30K, 40K. It depends 50K
Okay.
also. And if you get a government
Okay.
job, it depends like 60, 70, 80, 90. If suppose MD,
Yeah.
so you can get 85, 90 also. K. So
Right. And
it depends
sir if
upon your
somebody wants
caliber.
right and if somebody wants to open a clinic like you have so before opening up the clinic basic criteria क्या क्या एक BHMS डॉक्टर को आना चाहिए
As a
that
homeopath,
he's
he should
quite
be as a homeopath, he should get undergo some clinical training with any under homeopath because अगर clinical training नहीं होगा ना he won't be able to treat many cases. Even acutes तो drastic fail होंगे and acutes are bread and butter. Acutes are bread
yeah
and
got
butter.
it
And like I told you, if you don't give a right remedy, it fails, and he'll say that homeopathy doesn't work. So homeopathy has never failed. We homeopaths failed.
okay
That's an art.
right
Homeopathy has never failed. We homeopaths fail to understand the case and to give an appropriate medicine. That way it is.
okay and sir admission in MD is like 3 years and do you have many branches in
Yes, we
BHMS
have
also?
yeah. We have pedia, we have psychiatry, we have organ of medicine that our subject, and we have uh, organon, we have materia medica, we have practice of medicine also. So we have 5 to 6
Okay.
branches. Yes.
Sir, I recently saw your last story just yesterday, which you have put up. It was homeopath for the plants. Am I right?
Yeah, in agro homeopathy. So
Okay.
there's a friend of a colleague of mine, Dr. Weber. He's from Indore. He has done
Okay.
extensively research on agro homeopathy, and in abroad it is quite popular. Agro
Okay.
homeopathy in abroad. in abroad, not in
Right.
India. In India, very few homeopaths do agro-homeopathy. So there's a colleague of mine, Dr. Weber. He has been doing amazingly everything through homeopathic medicine, even to control the weeds. He has got the award from Indore Airport. He had done a project research of
Okay.
weed control in airport. So it was
Oh
super
wow.
successful. So the airport director gifted him an award. So
Okay.
to help
Sir,
through
so
only
is
through
this field in
agro-homeopathy.
India?
Yeah,
Okay.
is this field is it's totally up to you. You can practice it. There is not specialized course for it,
Okay.
but you can do it by
Got
learning
it.
by yourself. Yes.
Okay. Right. And sir, you guys start doing patients from which year?
From second year itself.
Okay. Like our patients, you start dealing with them and
No,
you start doing
we
them.
go from prescription is like
Okay.
from third year, fourth year. So these days syllabus are pretty changed. Like in my days, we were started from second year only.
Okay. Okay.
So
Because in dentistry, we do our first patient in third year for sure.
no, we generally start from we get exposure from second year and we take the case taking part is started on third year. But you have to see the
Okay.
patient, keep observing the patient. It starts from second year also.
Okay, got it. So, sir, my questions come to an halt. Let me see if we have anything from the audience. Sir, so opening up a clinic of a homeopathic clinic, does it require a huge investment?
Not at all. Not at all. See,
Okay,
our medicines are very, very minute doses, and we have to dispense it. That's the art, and
okay.
it's very less investment. It's not like you need a lavish clinic, but yes, it's very cheap. It's nothing like you need a lot of equipments for that.
Sir, agropathy, is this course online available in India?
I believe there are many courses available for Indians by uh, taught by some good agro homeopaths from abroad. They have been
Right, got it.
yeah, yeah.
Sir, are you following classical homeopathy?
Yes, I'm purely classical Hahnemann homeopathy and I'm against patents and tinctures and everything. I'm purely single remedy homeopath.
Okay.
Yes.
Sir, veterinary homeopathy.
See, there is a course also for veterinary homeopathy, BSc in vet homeopath, and even many people from abroad do that. And for if you have studied BHMS, you have to treat as the same as a vet. You need to have a good knowledge of medicine, and you need to apply that same on vets. That the same way. It's nothing like something extraordinary. Few things you need to understand about their organs and how they function, and then only you can practice it. So veterinary homeopathy also has a great scope because in abroad many doctors have specialization in homeopathy, especially for vets also.
What brand of meds do you prescribe for the patients?
See, we use all German brands, like which is collaborated with Germany and produced in India, which manufactured in India with the collaboration of German. So we have all German meds, and we prescribe
Okay,
very minute doses to a patient, very minute, like
okay.
almost like one drop, two drop. It's hardly
Oh,
few just few drops.
okay. And sir, do we have Indian brands coming up in
Lot,
homeopathy?
yeah, a lot of Indian brands. Yes.
So, sir, a very good question. Just a second. Can dental caries be reversed with homeopathy? I would like to know your perspective.
Yeah, if there is one, like if it's like only the upper enamel, the partly enamel can yes, but if it's completely all the crown area is gone, we cannot.
I got it. We can use homeopathy firstly as a preventive measure. Sir, yes, one question that I just right now is coming to me. It's like, can we use homeopathy in prevention, as a prevention? Is there any, like we use to teeth brushing, etc. So, homeopathy ko, in a way, we can use it in a daily routine?
It's nothing like that. If suppose who has a tendency of like have a history of recurrent caries, and
Ah,
one teeth was like infected, and
okay,
RCT also failed, and he has to remove that teeth. Okay, and he
okay.
has a history of tobacco abuse, so we have to select in that manner. We have to give the medicine so his next teeth or rest of the teeth can be prevented. That way, it is a
Sir,
prophylaxis.
Got it. Sir, you mentioned the word tobacco. Yes, another question that I have being a dentist is in the patients who use tobacco products and जिनसे नहीं छूटता because of nicotine and etc. and because it's a course habit since 20-25 years, homeopathy can help in a better way.
Definitely, but if he should have at least a willpower, then only the
Right,
medicine can
got
help.
it.
If he doesn't have it, nothing
Exactly.
works. Nothing works.
Right. Okay. After BDS, what we have options instead of MDS, a very big video is there on the YouTube channel Dr. Battisi. Please go ahead with that. It's a very big video. I have mentioned all the things in very detail. Scope of homeopathy in abroad after BHMS. As sir, would you like to add on to what you have already mentioned?
See, you have to see all the rest of the countries have a different rules. They require a minimum eligibility. But if you want to work in UAE, there is a lot of scope. You can give the examination and you can practice in UAE.
Sir, Pakistanis are allowed to enroll in agropathy. Actually, I guess it depends upon the course, and if it's available online, everybody can.
Every can, everyone can do that agro homeopathy. There is nothing like specialization required for agro homeopathy.
So, how to know? मतलब allopathy and homeopathy both works well for every body, every human body. ऐसा तो नहीं है ना कि किसी human पे homeopathic works better or some other. It's
See,
equal. It's
it's equal. It's everybody's susceptibility. The only thing is that we don't palliate more. Like if suppose if you're giving a any case you're having is taking long term any medicine, and now he
right,
has some counter effects of his organs are getting damaged, and that time you know at that time it becomes too late, right? So
right.
that time homeopathy can help, but if from early stages if he's taking homeopathy, that it might help in a more better way. That's the way.
Right. And sir, regarding cancer patients who are on stage 1,
See,
जहाँ पे there is no surgical intervention needed, so homeopath can
can
be
have yes can be successful in those cases. There have been a lot of published articles and in many cases, and there are widely research are proven that in onco homeopathy also has a great scope, and in the last stages advanced stages palliative oncology has been always on the top by homeopathy. Like in many integrated science they have been using homeopathy side by side along with chemo radiation also to palliate the pains which are not all possible by chemo or their drugs.
right.
We can hold our hands and we can work together. There's a lot of scope. That the only thing is this:
Exactly,
the
exactly.
who has who we have to be first open-minded. The first thing is that
Right, right.
you cannot be rigid
Because now
with
there
one
is
science.
no boundaries. We
Yes.
can, okay, got it. So, last question, which is better after BHMS if our goal is to do clinics? Is there any advantage of doing MD?
It's about more of clinical exposure, and if you're well prepared and if you're well versed with your clinical experience after BHMS, I believe you can open a clinic. And if you go into more into teaching line, or if you're more into lectureship or more of exposure, and you have to publish more papers and in you have to publish, so it's a minimum category you should be MD. So MD.
Okay, got it. And sir, if anybody wants to work with you after graduating as a BHMS, what is the
They all
criteria that you see during the interviews?
they can come for 6 years, 6 months training here at my hospital, and I'll provide
Okay,
them whatever they need in their like whatever they need to learn in practice and how to practice in after BHMS, and all the confusions and doubts will be answered here itself in the hospital because they themselves will see the patient and they themselves will treat them. So they'll get confidence from their own own vigor with their own confidence only can help them that okay homeopathy works like this. So this own self-realization is very much important in our science, basically, because many people lose faith that okay, I gave the best remedy, but it doesn't act. But you need to be very precise what you're giving and what you're not. So it's very different process.
sir, the basics जो homeopath में use होते हैं, the medicines, they are originate like they are coming from where? Like the plants or the
Plant.
chemicals,
We
like
use all the
artificial.
plant, yeah, plant, animal, and mineral sources.
Okay, got it.
It's more of naturals.
Okay,
Yes.
sir.
Thank you.
Got it.
Thank you.
Thank you so much, Dr.
Thank you.
Jitesh. It was lovely meeting you.
Thank you. Thank you, same here. Thank you for giving me opportunity. Thank you.
No problem. Thank you, and lots of love and respect from Delhi.
Thank you.
Take care. Bye bye.
Bye.